Hello, today I'm going to be talking about the global ethical dilemmas in nursing. So I made an agenda page, so I'm going to do an introduction of myself. What are ethical dilemmas? What are ethical dilemmas in nursing? What are ethical dilemmas in nursing? Why are ethical dilemmas in nursing a global issue? What are the main issues ethical dilemmas cause in nursing? What parts of patient care are affected by ethical dilemmas? I got a graph of ethical dilemmas in nursing. What can nurses do to attempt to resolve this issue? A summary of everything, and then a thank you slide. So, the introduction. Hi, my name is Cadence Bartholomew. I'm a nursing major at Bloomsbury University, and I chose to do this topic because I want to be a pediatric or labor and delivery travel nurse, and I'm a nursing major at Bloom, as I said. And I feel like it's going to affect me and can also affect other nurses in the world. I've actually seen this effect in process with working at a hospital. So, what are ethical dilemmas? Ethical dilemmas are a situation in which there's a difficult choice that has to be made between two courses of action, either of which entitles transgressing a moral principle. So, pretty much there's two topics that are talked about, two or more topics that are talked about, and there has to be a solution, but the solution is going to either go against or go with a moral principle. So, what are ethical dilemmas in nursing? Ethical dilemmas that are in nursing are when a nurse faces a situation where she or he is forced to weigh different factors and make the decision based on two or more ethical principles. So, pretty much like as it says here, there's two or more decisions or two or more dilemmas that they're going through, and they just need to try to see which fits the best, try to find a solution and see which one fits the best for that solution. So what are the main ethical dilemmas why are ethical dilemmas in nursing a global issue? So ethical dilemmas in nursing are a global issue for two main reasons. There is a couple more reasons that are within this, but these two main reasons are that hospitals are short-staffed and that there's a lot of outdated equipment. And both of these will go into what my next slide is going to be talking about, which is as one of the main issues for ethical dilemmas is that, so patient rights. So this is the right for patients to say yes, no. This will end up being affected by these ethical dilemmas because these people don't know, the nurses or the healthcare workers don't know which way to go with that. The equality of resources, so just seeing what the patients deserve and everything, will also get affected by this. Confidentiality of the patients, so this could be through, this is just keeping their information to the nurse's self, but then if they're with the ethical dilemmas, or keeping the information within the hospital, and with the ethical dilemmas, then they really have they're faced between these three options, as I said, of how to, where to go with this. For the confidentiality of the patients, which is a very high thing in the hospital, and so is patient safety, which is the next one on here. And along with the confidentiality, ethics of privatization, which is just somebody having privacy, which in a hospital, you need a lot of privacy because you don't want to be bothered by people. You're going through your own thing. You kind of just want to do your own thing. And then informed consent. So this is, again, going along with the patient rights, that patients need to be aware of what is happening, when it's happening, if it's happening to them, so you got to inform them about what you're going to be doing, and then they got to say yes or no, and they got to know what's going on. Dealing with the opposite sex could be an issue with this, so I feel like that one is kind of pretty self-explanatory with how it's going. And then beginning and end of life care. Beginning of end of life or beginning of end of life care. So these ethical dilemmas have influenced the beginning and end of life care because with having all these different options, these the people are given all of these different options, and if the nurses don't know how to explain them, or if they need opinion of somebody else beforehand, these dilemmas will cause issues with that. So I then got into a graph of ethical dilemmas in nursing. So pretty much on the screen, the numbers go in order of 4, which is the highest, and 1, which is not even on the screen, being the lowest. And so these are all of the things except I think 2 that I listed on the slide before. So patient rights, equality of resources, confidentiality of the patients, patient safety, conflict of interest, ethics of privatization, informed consent, dealing with opposite sex, beginning and end of life, and healthcare worker ethics. Which with the healthcare worker ethics, that one is just going to be how the healthcare workers work. And if they're having these ethical dilemmas, they're really not going to know what to do, which is, I feel like, a common topic throughout all of this. And as you can see, most of these were 4. And then the categories on the top were the size of the problem, seriousness of the problem, how they're going to solve the problem, and the status of people's awareness. So as you can see, most of these are 4s, but then there is some 3s. There's 1 3 with dealing with opposite sex for the seriousness of the problem. There's another 3 with the healthcare learn ethics, and there's a couple more 3s, and then there's some 2s, which could be the feasibility of solving the problem for the beginning of end-of-life care or for the patient safety. And again, patient safety comes first in a hospital. You need to make sure that they're safe at all times. And all of these are and ethical dilemmas will affect all of these in many different ways. Then I wanted to talk about what can nurses do to attempt to resolve the issue of these ethical dilemmas. So they first have to identify the issue, whatever is going on. Then after identifying the issue, they need to speak up. And then with speaking up about what the issue is, they're going to seek perspective from other people. And then if seeking perspective doesn't work, then they need to refer to the code of ethics, which can further help them. Lastly, I wanted to do a summary of all of this. So ethical dilemmas are all over the world. They're extremely difficult to deal with. Patient care is the main issue that nurses face with these ethical dilemmas. The main parts of patient care that can get affected are patient rights, equality of resources, confidentiality of the patients, patient safety, ethics of privatization, informed consent, dealing with the opposite sex, beginning and end of life, after facing these, nurses have to come up with strategies to resolve or help to resolve them. Some of the solutions that are most effective are that you need to identify the issue, then speak up, then get someone's perspective on the issue, and if needed, look at the code of ethics. Thank you for listening to my presentation, and I hope that you have a great day.